What's up, guys? John here with Big Drew, Tight Lifestyle.
Big Drew, Tight Lifestyle is Friday once again. This is Tight Lifestyle every Friday. Check us out at 2 p.m.
What's up, guys? John here with Big Drew, Tight Lifestyle.
What's up, guys? John here.
And Big Drew, it's Tight Lifestyle. It's Friday. We're ready to get it going. We want to jump right into it, guys, because you guys have been real good with the questions. The more questions, the better. Keeps us focused, keeps us going. Shout out to everyone for tuning in.
Yes.
I'm going to jump right to these topics,
Yes,
guys.
thank you guys for all tuning in. Titan Lifestyle with Big Drew every Friday, 2 p.m. Hey, we're going to start this off with, listen, guys, if you guys are liking the stuff that we're bringing you guys every week, please like this, share this, right? Tag some people in it. If you guys are on YouTube, hit subscribe, hit the all notification bell. Make sure you guys are getting this out to other people that could really benefit from the stuff we're talking about, or maybe possibly even been entertained by some of these subjects that we're bringing to you guys. So this one wasn't on the list, but me and Drew were talking about beforehand. And I'm sure if you guys grew up in the 90s and 2000s, you guys knew who I'm talking about. Big shout out DMX, rest in peace.
Yes.
50 years old, man.
50 years old. It's a sad story.
Sad story, dude.
Drug-related, addiction-related, I believe. I think he said he was... I mean, I don't want to say anything wrong, but I last I think I heard, it was either him or someone else saying that he's been dealing with addiction since he was 14.
Oh, yeah.
I guess one of his mentors, I guess you want to call him. You really call him mentor.
Got him started.
I guess he smoked some marijuana, had it laced with crack.
Yep.
That pretty much got him hooked, but it's been an ongoing thing. You guys know who DMX is. He has plenty of... I don't know if he's gotten Grammys and stuff, but I mean, he's been all over the world.
He's got a really
He's
original
worldwide
voice.
known. He's got an original voice. He's got a hard, rugged feel that a lot of people can relate to.
A lot of passion.
He's a lot of pain, a lot of stuff in his music too.
Yeah, man. Yeah.
But it's a sad story, and I guess he was in a coma because of the drug overdose, and his family or friends had to make a decision. There was no brain activity, and he wasn't functioning. So
I guess he had a heart attack too.
yeah, heart attack. That's what it was. Yeah, heart attack.
It's a horrible thing, and this guy was, and nobody would know it, but this guy was smoking crack all the way through all these albums and everything like that. And like you find this out later, like, oh my god, how is this guy doing it? Yeah. Nobody let this out. Like it's just pretty crazy. So drug abuse is a big thing out there, and it does ruin a lot of lives and people's health and stuff like that. So if you are drug abusing, please, do it. Try to get out of it for your family, for yourself. So big shout out to DMX, rest in peace, man. This is a bad and sad story. So
yeah, I feel bad for most of the people around him. Every time I hear of an overdose or a suicide or something like that, the people around the person are obviously more affected by the person himself. So sad story. I'll be playing DMX on my playlist for the next couple of weeks in the gym.
I was before this,
as
man.
As soon as I get home, I'm cranking up the surround sound DMX all night.
Get you going.
So, yeah.
Absolutely. So what's up, guys? Thank you guys for all tuning in. Matthew Boylan, Manuel, Esteban Jamez, David Charles, Soltis Jacobs. How you doing? MBT Sucks. Schwizzle 2.0. Ray Cardilon, Black Weldis, Lady Hawk, Son of Stewart, Ma Bosseler. What's up? How you guys doing? Sammy Gross, Fiesta 50, Resume, Perfection, Cigar 10, Martin. How you doing? Kilgore, John and Mareberry, Patty Manson, Board. How you guys doing? Big shout out from Brazil. Love it. I love it. How you doing, Jolene? All right. So you guys all join in DMK Fitness. I appreciate it. So we've got our awesome therapy of the week to talk about next. So this one is definitely one of my favorites. A lot of people's favorites out there. It's Hercules Potion.
The Hercules
Potion, right?
The Hercules Potion.
Don't accept any substitutes for this. A lot of people try to knock this stuff off, but can't even get it. So at that point, this is a signature Titan Medical Center amino acid injectable blend, only doctor prescribed. You can't get this anywhere else. So this one's really, really popular because it doesn't have any hormones in it. Anybody can use this and should use this. And the reason why is because it has awesome things that your body needs.
Yeah, non-anabolic.
Yeah, non-anabolic.
I always hear people say, is Hercules Potion HRT? Is it a testosterone? Right. Is it anabolic? It's non-anabolic. It's basically just aminos, the stuff that you get in the powder form at the store, the cheap stuff that messes up your insides. Just an injectable form.
Injectable form, pharmaceutical grade as far as that goes. So everything's tested, endotoxin testing. You guys are injecting this, and let's talk about what Hercules Potion has in it. If you guys have any questions, give a big shout out. How you doing, Jolyn Memberry? Oh, what's up? All right, so Hercules Potion has glutamine, arginine, ornithine, lysine, L-citrulline, proline, taurine, NAC, and L-carnitine. This thing is packed with great things that are going to help you in a number of different ways. Let's talk about the different ways. So glutamine is going to help with recovery. We talk about that a lot. Recovery is huge. That's something you're not going to know instant gratification wise.
Yeah. And a lot of times people take glutamine, they take it in powder form. They only take it after they work out. It's good to take it before you work out, too. So it's also with the Hercules, and it has glutamine in it.
Yep.
It's good to take it before you work out. A lot of times you always hear post-workout glutamine, recovery. It's good to take it before and after. So that's huge with recovery. I notice if I don't take my glutamine, I start getting a little bit more sore. Not crazy. I mean, it's not drastic. But just that little bit of difference lets me know that it's speeding up my recovery process.
Absolutely, 100%. Rob Cook's in the house. What's up, Jack's Boy Fit?
Rob Cook, that's my boy.
Big shout out to him. He just got a Hercules Potion.
I'm gonna get you the right size shirt. We sent you a 2XL. He said I need an X. He said I need a large. He's shredded now, so he wants
All right,
I got you, Rob.
We got you, dude. We got you. So he said, love the
there.
product. It's amazing. Great pump, great recovery. So
yeah.
let's talk about that next. The pump factor.
Insane.
Arginine and L-citrulline.
Insane.
These are two main combinations, precursors to nitric oxide, vasodilators, opening up that blood to pump right to the muscle and all throughout the body. This will help in a number of different ways and has a lot of different health benefits too, not just the pump. Cardiovascular health from arginine, L-citrulline, nitric oxide in the body. It's a big, big thing to look at. Also will help with sexual function, right? Because blood goes down to the extremities.
Kill two birds with one stone.
Bam. Hey, that's just a great side effect, right? But muscle pumps. So the big difference, because everybody's like, listen, I can take this orally and maybe double a dose or whatever it is. It's a lot different of effect. So if you take a pre-workout that has this in it, or something as far as a supplement orally that takes this in, you guys might get a pump, but usually it's like a 15-minute, one and done pump. You're like, oh, I'm in the gym, man, I got a great pump, and then you're out the door, and man, it's gone. This is a long-lasting pump, 4 to 6 hours usually. If you inject this, you boost down on the pool side, do 50 push-ups. You're pretty much good to go and pump for a long, long time.
And one thing I will chime in on, the other day I did triceps. I was supposed to do triceps. I did chest. My workout was supposed to be chest and then followed by triceps. I only did chest, but I put the Hercules in my triceps.
Oh, yeah.
My triceps were pumped as if I did triceps. So a lot of times, like relating it to powder form, if you take something in powder form, it may evenly distribute to your body. You may drink a gallon of water and piss it out and lose it. Your money's going down the toilet. But with this stuff, like, I don't even need to really work out to catch the pump. I mean, obviously, the more blood in the muscle, better. Absolutely. You're going to have a better pump.
Absolutely.
But, I mean, guys, if you're in a rush, you want to go to the beach, you can put one in each bicep and have it pumped without even doing a full workout. I mean, literally just move your arm up and down a couple times just to work it in, and it just stays pumped up.
It's awesome.
So it doesn't need to be like, hardcore all day to get a pump. When I used to be a bouncer in the club, I used to have my little routine before I went to the club to catch a pump before I walk in. Yeah, you got to walk in swole. But and I used to have my little routine I used to do where it was like, dips, push-ups, all this stuff. A shot of Crown, back in my crazy days, get the blood going.
That's right.
Now I could just literally boom, boom, and not even do all that stuff, no liquor, no anything, and the veins start sprawling, and they stay there all day.
Absolutely,
so it's
man.
Perfect, guys. Perfect for the pump.
These things will also help increase vascularity. So the more vascular you are, right, the more leaner you are, it's going to show through, predominantly. You're going to see
pressure.
It a lot more, right?
Blood pressure, too, guys. If your blood's moving around in your body and it's open, your blood's freely moving, it's going to lower your blood pressure.
It should help out
another
with
thing
that
people
too
don't
as well.
talk about with Hercules. If your blood's moving, your veins are all open, the blood's going through there. They're not stiff and clogged up. So it's benefit all levels with this stuff.
That's definitely a good point, man, for sure. A lot of people do miss that. Ornithine, anti-fatigue amino acid. So it's to make you do longer, more strenuous workouts or activity, whatever it may be. Whether it's hiking, working out, running, walking around Disney World or whatever the whole day with the family. This is really, really great. And also help in the bedroom too for more activity. So you should be able to go longer and harder for sure. Lysine, immune system boosting, right? So when we work out or we do any strenuous activity, our body doesn't know, hey, listen, we're lifting weights. It just knows that we're putting stress and strain on the body in one way, shape, or form. We're breaking down muscle tissue and stuff like that. So at that point, too much stress on the body, right, will ultimately affect the immune system. Now, this is good stress, not bad stress, because bad stress is like you freaking out, anxiety, and things like that. But it can still have a stress factor on the immune system, which could break it down. This will help fortify the immune system and bring up the immune system, so you have that great immune support as well. If you have, if you have cold sores or herpes or anything like that, because a lot of the population does suffer from this, this will also help HSV1 and HSV2 as well. So it's just it's a double swing at what you guys are trying to do there. Proline, collagen-based amino acid, good for lubrication in the areas. L-carnitine, great for weight loss. Nervous system, blood flow. Taurine, great for brain function. Anti-cramping, so that's another big one out there. People get a lot of cramping and stuff like that. NAC is great for liver as far as that goes, so you got some liver support too as well. And the best thing about this is you can spot inject this. So if you have a lagging body part, or you want to work at a certain area, or you're going out to the pool per se, and you want those muscles to really protrude better than they usually do, this is where Hercules Potion really does take the cake for instant gratification. I love doing that. Yeah. Chest, buys, tries, whatever I'm working out that day, or like I said, if I'm going out to the beach or the pool or a photo shoot or whatever it is.
It lasts too. I mean, it really does last. I've hit the gym hard without taking anything, hard, for a couple hours, and the pump doesn't last. This is literally it's almost like a cheat code. You take it and you work out for 5 minutes, and the pump is better than if you went to the gym for an hour.
Yeah, so, man. It's crazy, even on here. So, Eric,
don't get lazy on it, guys. You still got to work out, though. Yeah. You can take it if you're in a rush and get a pump. Right. But you want to work out too when you take it.
The whole point, because you're not going to be able to build muscle without working out or lean tissue, right? So
you got a quick pump for the ladies,
right?
That's what we're talking about.
If you're going out Saturday night, possibly you want to really look swole and stuff like that, pumped. That's kind of where you can do this. Even if you want to just do push-ups or whatever it is, it'll definitely help in that aspect. So, it's got a lot of different benefits and a lot of different ways you can use it.
It's water-based too, guys. Water-based. You guys always hear injectables. If you guys have used testosterone in the past, whether it's on your own or through your doctor, that's oil-based. So if you hear us say spot inject, and in your mind you're thinking oil-based, it's not like that. Right. I'm not going to put my testosterone recipient in my tricep or my bicep.
No, definitely.
It'll probably hurt like crazy, and it's just not designed. It's just not. No. It's better to do the glute or the quad or the lat or the delt. So, but yeah, it's water-based, guys. You don't feel anything. And again, you use a 30-gauge half-inch, which is like the size of a gearing bag.
Insulin needle, right?
Yeah, it's a little prick. It's almost like the prick where they prick your finger. It's a tiny little prick.
Definitely virtually painless at that point. So you guys will be able to use it, and girls and guys can use this, not just one, right?
Ladies, if you want to
pump
hit the glutes, hit the glutes. Yeah, if you hit the glutes on the top, hit them in the right spot, it'll flare just a little bit. I mean, obviously, it's not a butt injection where it's gonna stay there. But if you have a photo shoot, if you're doing some glute kickbacks, put one on the top of each side of your glute, do some kickbacks, and you'll see the little cuff. You'll see a little bit of a pump there. Yep. That's when you go take the pictures before the pump goes away.
Okay, so Eric Cord said, yesterday was my first day taking it. I always have extreme pain and soreness after workouts, but not with Hercules Potion.
That's good.
So that's another thing. People train real hard and they take this something man, I don't know if I worked out hard enough because I'm really not sore. Well, that's the point. This is supposed to help with recovery for you guys. There was a question on there from Davis. I think it was, where do I inject this? I've been injecting in my deltoid. I don't know if it was on YouTube or what. It was behind the current screen that we have here. So at that point, it was on Facebook. So where's the best place to inject tests? I currently inject in the shoulder. So Joe Davis, this is a little off topic, but if you're injecting testosterone, now this is really a personal thing, I guess, because some people like to inject in legs. Some people like to inject in shoulders. For me, I injected my glute. It's real easy, real simple. You're walking around using your legs the most, so really you get that blood flowing through there. It's a big muscle too, so the shoulder is going to be a lot smaller of a muscle. So injecting in your shoulder might cause some soreness or irritation per se.
The shoulder's big too, guys. Make sure you're hitting the right spot.
Right.
If you do your delt and you're doing say you're up towards the front of it.
I wouldn't do that. No.
I mean, you want to get when you hold your delt sideways and you lift it. See how the delt is round from here? It should be dead center. like dead center in the middle of your delt. So if you can't see it, lift it up and down, you'll see it. But I hear people do delts, they'll like do it here, and it won't be in the middle.
Oh, no.
And that's where they have the problem. And again, too, if you're doing your delts, make sure it's in there.
Absolutely.
Make sure it is like pushed in. If you need to push in a little bit on the skin, just to, for a mental thing to make sure it's in there, that's fine.
Yep.
But make sure you're going deep enough in there.
Yep.
Don't go at an angle, because then you're going to have like a little pimple. You're going to be wasting it.
Yep.
Because the Hercules is going to be sitting underneath your skin. It's not going to cause an infection, but it's going to be sitting there. You want it to be in the muscle.
Right.
So make sure you go deep enough. And if you guys have any questions, message me on Instagram or message me on Facebook. I'll walk you through it. Or there's plenty of websites where it'll tell you how to do it.
Absolutely.
How to do your injections.
John, did you guys see the Hercules Potion poll that we had last week? We didn't get to it.
I didn't get to it, but we can get to it now. Teresa, IBB Pro, what's going on, Teresa? How you doing? It's good to see you on here. If you got any questions,
Big
shoot
Rod.
away. Big Rod's in the house. Big Rodney, 4 Frank, 4 Sports. What's going on, brother? Athletic Scholarships, how you doing? Jake, how you doing? Dread EQ, what's up? Juan Martinez, Jordan Montero, Edda, By Jennifer's, how you doing? What's going on? Stephanie DL Kadskik, it's Dallas, how you doing? Helton, Chris Susie, Seppa Davison. Wow, this is crazy. Does your body stop producing testosterone after taking it through injection? So this is a good question. Now with this, what happens is if you take testosterone, what happens is you're going to take it from an outside source, right? Whether it's a cream, an injectable, oral form, even pellet. So when you inject this or introduce this into the body, what's going to happen is your brain and your body is not stupid. It knows right away. And what it does is it's basically your brain is going to, it has a signal going on to your testicles. So that's where testosterone is made for men. And at that point, it says, listen, we don't need you to work. So it cuts off that signal and then it suppresses your natural levels. Now, if you're doing HRT properly and correctly, you'll have gonadal support. So HCG, Clomid, gonadorelin, Kisspeptin, some people are using. But at that point, what happens is it keeps that natural signal on. So, or mimics the signal with HCG. But at that point, it will keep your natural production of whatever it is. Now, remember, every year you're going to lose at least 1% or more of your testosterone, no matter what. So at that point, it will keep it up if you're taking these other medications along with it. And that's why we do here at Testosterone as far as Titan Medical Center. If you're on HRT with guys here, you're going to go on testosterone, a gonadal support, and usually an aromatase inhibitor, okay? That's to combat any negative side effects whatsoever and get you all the benefits that you really should be getting from testosterone or hormone replacement therapy. So I hope that answers your question, all right? Because if you don't take anything, it's going to suppress your levels and crash your levels naturally. So if you do want to, per se, get off later on, it's going to be harder to boot back up and really get what you're at. But if you need HRT or TRT to begin with, it really doesn't matter to a certain extent, right?
Yeah. Plus HCG will.
Yeah.
HCG will definitely bring your natural back up too.
Oh, for sure.
So a lot of times people think, oh, my testosterone's low because I've been taking testosterone so long.
Yeah.
So they just take a whole bunch of testosterone, cypionate, or enanthe,
Yeah.
and try to make up the difference. That's just putting more synthetic test in your body, which is going to shut your natural down even more. So you want to stay at that 200 or whatever your doctor is per week.
Yep.
There's a reason why it's supposed to be like that. You start putting 500 to 1,000 milligrams in your body every week. Next thing you know, you're gonna be messed up, and you're gonna be so far in the hole that it's like almost impossible to get out of that.
Yeah, you guys, honestly, you guys don't need that much testosterone as far as that goes. Like, it's quality over quantity all the time. What you guys are doing.
You guys don't believe me? I do 200 milligrams, and if you want me to do a video on it, a live video, so you guys can actually see how much I take. I can carry this weight and only take 200 milligrams of testosterone. You don't need a lot of testosterone, guys. I've taken 1,000 before. I went that route years ago on my own. Yeah, I'm gonna do 1,000, and all I did was get bloated.
Right.
I was bloated. I was just I didn't feel right. You know, I was all over the place.
You know, it's funny because I seen a picture of you, Antonio, and James from yesterday, right?
Yeah, yeah.
And somebody wrote on that picture like, man, how did Big Drew get even bigger, Drew?
Yeah, bigger Drew. Yeah. But the thing is, I'm actually about 10, 15 pounds lighter than I used to be.
It's just quality.
It's just the quality of the look.
It's quality of the look. It's awesome, though. It's a big compliment.
I like
to you,
it,
man.
yeah.
It's awesome. Hilton, Cordado Legacy, what's going on? Brandon Vega, Rose T, Sonny G, DC Baker, how you doing? Alex, what's going on? Z Broughton. All right, I'm on trifecta package, but what else is good for recovery and joint pain? So you're going to want to look...
BPC?
That's right. You knew it right away. BPC 157, man. Great for recovery. Great for inflammation in the body, and if you have joint pain especially, this is going to be hopefully a game changer for you. I mean, I know it is for me, and I know it is for a lot of other patients that have went through some of these different things that you're talking about. So, what's up?
And that's something you spot right into the area too. It helps a lot.
Yep.
TB500 not so much. It kind of goes all over your body.
Yep.
But that BPC, you can put it right where the pain is. So if it's knee, elbow, wherever it is, you can put it. Don't put it into the tendon. Don't put it into the bone.
Subcutaneous.
Sub-Q, but around where closest to where the pain is at.
Yep. Best way to do it, guys. And if you guys are a patient of ours, and we supply all these different things, HRT, hormone replacement therapy for males and females, medical weight loss, vitamin amino acid injectable therapies, like our Hercules Potion we were talking about, rejuvenation detox, like glutathione and such. We also do medical weight loss. I think I already said that one. Libido enhancers for guys and girls. Peptides, so BPC 157, TB 500, weight loss peptides, and blood work nationwide. And you don't have to be a patient. You don't have to take any therapies to get blood work. It's real simple, real easy just to do that. So if you guys want any of these services or got questions, just call or text 727-389-3220. Wolf of Sports, what's going on? Holding Outlaws. So that's one of my guys right here. BBC 157. He's told me awesome things. Nice. You two are breaking sidewalks, he says. That's awesome. Drew's going to break them. I don't know about me. The Donut Killer, Brian Younger. Have you guys ever considered SARMs? Any opinion on them? So I think we talked about this last week a little bit. So from our perspective, select androgen receptor modulators, SARMs. They really were designed to take the place of testosterone HRT replacement, right? But, if you're taking something orally, especially with these SARMs, they have high toxicity levels on the liver. So they're taxing the liver when you're taking them. And, if your levels are that low per se, then you really just want to go with HRT. I mean, it's just way better on the body, healthy-wise, and you're going to get the result that you're looking for. Where SARMs, if you take them now not only are you possibly doing damage to the liver, but at that point, you're probably going to suppress your levels, your natural levels. And then at that point, you're going to have to go on HRT.
You got to play catch-up again.
Dude, so I don't recommend them. I know a lot of people buy them from research sites, girls and guys, but I'm telling you guys, we get a lot of people that come to us afterwards, and they're like, man, I took SARMs and I messed up my levels, man. It sucks. It sucks because at that point, you can try to boost them up. We can try ECG. We can try some of these gonadal support, FSH, and stuff like that to maybe bring back your natural function and hopefully get it back up if you're young enough. But man, there's not enough upside. There's too much negative side to what you would gain upside-wise.
And the thing with the SARMs too is there's a reason why they don't have them in HRT. There's a reason why they're not, prescribed so much as regular testosterone or something like that. And with the SARMs too, I've seen a lot of people having health problems with these SARMs. Yeah. Because there's not too much research on them. It's kind of like, you can get them. They're kind of cheap. They claim to work and this stuff. I mean, they may work, but you may have other health problems. I mean, people are having severe health problems from these peptides. And
Absolutely. So yeah, guys, there's a reason. The safety profiles on some of these things, and clinical research, because there's clinical research on some of these SARMs, and the reason that these pharmaceutical companies, because they were the ones that designed it, they didn't go forth with this is because there was problems, there was issues. So the
reason why it didn't hit the shelf.
Yeah. So if you're playing yourself as the rat, I mean, listen, guys, you guys are setting yourself up for hopefully not, but for failure, man. It is what it is. All right, Brian Younger. All right, what's going on? Copy that. DMK Fitness just received high-dose ECA, low-dose ECA, and Prometheus. If I take the high dose, this right here is definitely a crazy combination. It's a good one, though. Like, for DMK Fitness, he's always on here. He's always following us. He's always talking to us. He's sharing his journey. So this guy's lost an extreme amount of weight, and he doesn't want to plateau, and he wants to lose some more weight. So at that point, this is definitely a great combination. He's already had high-dose ECAs. He's already done that and taken it to a certain level. So at that point, yes, you can do this. He takes a high dose at 5 a.m., then takes Prometheus at 9 a.m. because you cannot take those two together at the exact same time. And then another low dose at noon. So yeah, you should be good there. You really want to spread it out 4 to 5 hours on these different things. And at that point, you should be good, and there should be really no negative side effect to it.
It's good to see you taking it the right way, too. A lot of times people get 2 or 3 things, and it's like, I'm going to take them all at once because I got them. It's good. It's good that you're doing it the right way.
Absolutely. When do you recommend another series of blood work? So usually, you can do blood work anytime, right? If you're on HRT with us, you're going to want to do it. We're going to have you. Mandatory. You're going to do it every 6 months with another follow-up with the medical provider every 6 months. and that's to check on you, make sure everything's fine, right? Make sure the blood. But listen, if you think there's a problem, if there's an issue, right, then we want a blood test earlier. We can run just single tests if there's something that's an issue, like high estrogen levels possibly, you don't think testosterone, you think you're getting the benefit, we can look at those numbers, and at that point look at, changing that, because it's a work in progress until you really dial in HRT, like, this dose of testosterone, this dose of anastrozole. HCG is about the exact same, but it can really change a little bit, and that's where the personalized regimens come into play. Can you take 2 Prometheus times a day?